We often get so busy pushing forward that we forget to stop and reflect on all that we've accomplished. And when Community Regional's Chief Operations Officer Robyn Gonzales announced she was retiring, hospital leadership staff came together to reflect on the impact she's leaving on the health system. Robyn Gonzales said her career selected her, and it all started when her mom brought home an ad for a job.
I was going to college. My mom brought home this flyer about a unit clerk job at University Medical Center.
Robyn started her career in healthcare in 1976 as a unit clerk at what was then Valley Medical Center, where she found joy in finding solutions to complex problems.
That camaraderie that happens when we're solving problems together, and it was in those times when I was like, this is what I was meant to do.
In 1999, Robyn rejoined community medical centers as manager of ambulatory care services. She continued to move her way up over the years, eventually overseeing the operations at Community Regional Medical Center.
There was a time not long after I became the chief operating officer that I was sitting in my office and I was looking out over the park at the hospital across the way. And it just dawned on me that I don't even know how I got to this chair.
Although she says she didn't know how she ended up in that chair, many of her colleagues, like Community's System Chief Medical Officer Dr. Tom Utek, say her hard work made her more than deserving of the title.
The most intense time came a couple of years ago during the COVID pandemic, where she was incident commander. I was the medical co-incident commander, and we spent a lot of time over those 2, maybe 3 years, depending on how many waves you counted with COVID, working together.
The COVID-19 pandemic was a time of uncertainty for everyone in healthcare, but leaders like Tina Gulbranson said Robyn handled it with grace and continued to push the team members across the system because she saw their potential.
So when we are pushed to the point that we feel like we can't do anymore, and then she pushes us a bit beyond that. And in reflecting on her leadership style, I would say that she brings out the best in the people that surround her.
Dr. Jeffrey Thomas first met Robyn when he worked as a resident at what was then Valley Medical Center more than 20 years ago.
Learning from an administrative standpoint how somebody dealt with a very complex and demanding schedule was my initial introduction to Robyn.
And now, as Robyn steps down from her position, Lucky Molly will step in and take the reins.
She does a great job of reminding us that we have to do everything to make things better for the patient and the patient's families.
I see Robyn as a calm, collaborative type of leader. She is very outcomes driven, but in a soft way that allows people to get to where she thinks is the best place to go. And she's always, again, focused on the outcome. And I want to make it clear that the outcome is always patient-centered.
And as Robyn prepares to leave, she shares her hope for the future of Community Regional Medical Center and the health system as a whole.
We see everyone. It doesn't matter how much money you have or don't have. We see everyone. And that requires then that we have resources, reimbursement, right, to help pay for that. And something has to change. And that's really my hope and desire, is that those things would improve, and the folks who work here and the patients who are treated here would see the benefit of that.
Community Health Systems Executive Vice President and Chief Operating Officer Craig Wagner shared a message of thanks to Robyn as she heads into the next chapter of her life.
Robyn is devoted and committed to this community and to our hospital, to our patients, to our team members. She's really set the pace for us from a missions perspective. Robyn, congratulations on a much earned and well-deserved retirement. We wish you all the luck. You will always be part of this family. We all love you, and thank you again for all you've done for this community and our organization.